So this position is more beneficial. It has what we call an effect size of 0.68, which is it's a good, strong effect. So we can say that kinesiology tape is effective at reducing pain, particularly compared to doing nothing or very minimal things. So we are seeing pain reduction with kinesiology tape in musculoskeletal pain. Now, if we compare kinesiology tape versus other interventions, let's say exercise, manual therapy, some other intervention, kinesiology tape has some effect, but not much. So you don't choose kinesiology tape over something else like exercise. You would obviously want to do exercise or another type of intervention if you had the choice. In terms of disability, can kinesiology tape reduce disability? Compared to a minimal intervention, it's possible. Okay? But if you are using kinesiology tape to reduce disability compared to exercise, it is not beneficial at all. In fact, it's almost harmful. If you are trying to reduce disability with kinesiology tape, then you are not doing good practice. You need to do something else. So the bottom line, the final part of this slide is to say kinesiology tape is effective at reducing musculoskeletal pain, and that we don't want to use it by itself. I just finished a mega review, which is a review of many meta-analyses. So I looked at 11 different papers, and I looked at the outcomes of each paper. What were the conclusions of these papers on the outcomes of kinesiology tape? We look at the effect on pain. So you'll see a plus sign. Plus means a good, positive, beneficial. Plus means it was positive, beneficial, but it was clinically relevant, meaning it was at a higher level than these studies. If it's empty, the study did not evaluate that outcome. If it's a 0, it means it had no effect. And if it's a question mark, it meant it's still inconclusive. And then a minus sign is harmful. First thing you see is no minus sign. Kinesiology taping is safe. It is not associated with harmful outcomes. It's generally very safe. The only thing that will go wrong will be a skin allergy, irritation. But it won't cause you harm if you try it. You'll see that all of these reviews show positive benefit on pain. And then everything else, strength, range of motion, proprioception, swelling, disability and function, either no effect, very small effect, or questionable effect. So that says, this slide tells me the only really thing that we can claim with kinesiology tape is that it can improve pain. We don't say that it increases your strength. We don't say that it decreases your swelling or improves your proprioception, because we don't have the evidence to say that. But we do have evidence of supporting muscles and joints. So you will see that it does improve range of motion. It does sometimes improve strength. But overall, we can't make a conclusion that it has these benefits. So what we claim is it reduces pain and it supports muscles and joints. We don't make any other claims because we don't have evidence to support it. So these are the outcomes that we follow, right here. Remember, my job is with Theraband Academy to catalog or to gather all of the research. So what I did last fall was reviewed all of the kinesiology taping research, about 250 papers. And then I put them into different categories of outcomes with these outcomes: pain, joint support, muscle support, neurological, circulatory. And then what I did was I said, which of these studies have significant positive outcomes? And I made sure that they had identified the technique that they used, did not include non-English papers, there weren't that many, and I excluded different reviews. So I took all of the studies and I pulled out what positive, significant improvements that we see with kinesiology tape and grouped them into these different outcomes, and we put them into the Academy database. So when you go to Theraband Academy and you go to research, you can search for kinesiology tape, shoulder pain reduction. And then it'll give you all of the articles that show that kinesiology tape reduces shoulder pain. And each one of these will have an abstract, the article, and the technique that was used. So this, again, is the benefit of Theraband kinesiology tape, is that now you can go and find the evidence with the specific technique that showed your outcome. So I can use evidence-based practice here to drive what I'm doing in the clinic. Instead of just guessing, we can use our research to support what we've done. Any questions so far? Good. So what, my questions then in the research were, what does the research say about the direction, the tension, the convolutions in the tape that you'll see, having to position the muscle, and what are the different patterns? What's the evidence? These are the questions that I wanted to answer from my review of the literature. Because in kinesiotaping certification, they just tell you what to do. And they claim that all of this matters. But only a few things, I think, really matter. I wanted to, this is not in your handout because I added this one. But this is a study that shows it doesn't matter what direction you put it in. If you go in this direction or this direction, it's not going to change the muscle activation. So you, again, kinesiotaping says you have to apply origin to insertion or insertion to origin, but there's no evidence to support that claim. What about tension? Actually, what kinesiotaping says is you have to have specific tensions for specific interventions. That has not been proven either. But what has been proven is that tension does have a factor in outcomes. We know that tension does have a role in the outcome. Based on Lim's study here, what they found was tension predicts success. So you have to have some amount of tension in the tape for a positive outcome. But we don't know what that is. We theorize that it's somewhere between 25 and 50%. Because lower tensions were associated with better outcomes. Higher tensions had worse outcomes. I'm sorry, effect sizes, not outcomes. More tension was associated with a smaller effect size. So less tension is better than more tension in most cases. So I then took all of these studies and I looked at what tension is being used in the research. And I found the vast majority of studies with a positive, significant outcome used somewhere between 0 and 25%. Then there was another batch of 25 to 50%. So basically, 86% of studies with significant outcomes use tensions between 0 and 50%. So there's probably no need to go beyond 50% in most cases. Kinesiotaping also claims that you have to have these convolutions. You know what convolutions are? So the convolutions are the wavy tape. This study came out and compared two groups of back patients. One that had convolutions, one that didn't. There was no difference between the two. So it questions then, do I really need to have these convolutions for the tape to be effective? Probably not. What about the pattern? So at kinesiotaping, they teach I have to do this specific pattern for this specific shoulder pathology. This is an example of an Olympic javelin thrower. I've never seen that pattern anywhere. Or that fingernail polish. There is absolutely no, I don't understand any of this pattern. So I question the fact is, do you need to have a specific pattern? There's no evidence that says this pattern is better than that pattern, or that they're the same or different. What's more frustrating is that these are actual shoulder tape applications in the literature from 7 different studies. So 7 different studies did 7 different tape jobs. They all have good results, but they didn't compare this one to this one or this one to that one. So the research is very difficult to interpret and analyze and draw conclusions. But my point is that you don't have to go and learn all these specific things. And what we're going to teach you are the basics. But you're still free to do whatever you think is appropriate. Just like with the CLX. I can show you the techniques. You then adapt it to your everyday treatment. This study just came out, which was interesting. One of the big claims that you'll see on kinesiotape is reducing swelling. This study showed it doesn't reduce swelling in acute ankle sprains. So what they did was they had groups of patients that had ankle sprains. One group got the tape and the other group didn't, and there was no difference between the two. Now, that doesn't mean that it doesn't affect swelling, because there are other studies that show that kinesiology taping does reduce chronic swelling, like lymphedema. We have some evidence of that, or chronic venous insufficiency. But an acute swelling, kinesiology tape may not be effective. But here's the problem. This is not the standard taping technique that is usually done for ankle sprains. It's usually, this is much higher up, and there's more unilateral side taping. So I can't say for sure that that study is even valid, but I have a feeling that it does not help with acute swelling. I think that it helps with chronic swelling. So when you hear claims, you have to be very specific. So I can say kinesiology taping reduces swelling, but not in acute ankle sprains, not acute swelling. In summary, many studies have many different outcomes. The bottom line is that it reduces pain, but it does so only really acutely within the first week. So you're going to